This poor dog is absolutely terrified.
Gypsy, Gypsy.
She's just cowering in the corner, so I'm worried that this dog's had something seriously traumatic in her past or lack of socialisation. Something's going on to make a 6-month-old puppy behave like this.
Hi, Gypsy. Hi, honey.
At the Bondi Referral Hospital SASH, emergency vet Lisa Chimes has been given a difficult case.
What's wrong, Gypsy?
6-month-old Gypsy has been brought in after struggling to keep any food down for weeks.
Want to go for a walk?
This poor dog is absolutely terrified.
Gypsy, Gypsy.
I just don't know how we're going to find out what this dog's problem is.
Aren't you come on, bub, out of the cage. Come on, sweetie pie. Good girl. Come on, dog. I know. What about some of this?
I've been told that she's regurgitating, but without actually seeing her do it, I don't know how we're going to diagnose this problem.
You're only a puppy. You shouldn't be like this as a puppy, bub. What's happened to you?
She should be jumping all over me, wanting cuddles, being energetic and wanting food, and she's just cowering in the corner. So I'm worried that this dog's had something seriously traumatic in her past or lack of socialisation. Something's going on to make a 6-month-old puppy behave like this.
Hey, Dale.
Lisa has now called in specialist Justin Wimpole to do further tests.
Poor girl's very nervous, ain't you? So, we'll try some liquid, see how we go. A bit touch and go, I think, still. We'll try to go slow with her.
So the test we're doing on Gypsy is actually like a live X-ray. So when she actually swallows, you'll see the food going down. And what we're hoping to find is the area where that food is getting stuck.
Come on. No, it's just not going to happen. What about a bolus of food? Come on, Gypsy. Come on. Ready for that?
Justin's had no luck. The fluoroscopy, this test we're trying to do, is an absolute failure.
Hi, Gypsy. Hey, honey.
We haven't got a diagnosis. We don't know what's going on with Gypsy. We have to move on to the next thing, which is a CT scan and endoscopy under anaesthetic.
I'm just trying to help.
She doesn't quite get it that we're trying to help.
No.
Gypsy. Gypsy. It's only food, sweetie pie.
At SASH, Lisa's trying one last time to persuade the terrified Gypsy to eat.
Come on, Gypsy.
The 6-month-old shepherd finds it impossible to keep food down.
It's okay, honey. It's all right. It's okay.
Gypsy's owners, Roy and Hazel, have now been called in to help.
It's okay, honey. You're okay.
Gypsy was Roy's surprise 70th birthday present after their previous shepherd passed away.
She's very loyal, and when we found out about this, I thought that we're not going to have her long. You know?
Yes, I think that's the worry, that they'll find something really horrible and untreatable or something like that. I think that's the big worry.
See what she does.
Now, Gypsy, what's this I'm hearing about you? No, sit down. Come here.
If Roy and Hazel can't get Gypsy to eat, the puppy will be forced to undergo invasive tests.
Wait.
My goodness. I can't believe she's eating. Oh, we tried very hard to get her to eat.
But within minutes of eating, Gypsy is becoming visibly distressed.
Well, she's really looking agitated now. Ah, she's feeling sick. Just regurgitated. Poor thing.
Come on, down. Come on, down.
This poor dog has really just been living with this chronic battle her whole life, and no wonder why she doesn't want to be touched. She's got constant heartburn, and that must be agony.
It's all right. It's okay.
Gypsy now needs a CT scan, but Lisa decides to send her home. The puppy is just too nervous to stay in hospital.
We're a bit like people with kids having tests, you know, a bit anxious about what they'll find out and so forth, so I'll be glad when it's over.
Hello.
Hello.
Hi, Gyps.
It's all right.
Gypsy.
6-month-old Gypsy is back at Sash and she's not impressed.
Okay, Gyps.
She's not happy to be here.
No.
Gypsy's so anxious in this hospital. She's scared of vets. She's scared of anyone except her parents. All right, Gyps. We'll look after you, sweetie pie.
Okay.
Lisa's hoping to find out today why the puppy can't keep her food down and is in constant pain.
Gypsy, come. That's the way.
Okay, bye-bye. I really feel for Roy and Hazel. They're so distressed and anxious. They've had Gypsy since she was a young puppy.
Yeah, I feel like a mum at preschool. I do love her a lot.
The investigation starts with a CT scan,
Very suspicious.
but it's inconclusive.
We've had a really good look at the CT, and as it gets lower down towards the heart, there's some definite narrowing. So obviously something is making that area a lot more narrow, and that's where the food is getting stuck.
The team needs more information. A camera is now being put down Gypsy's mouth through her food pipe. What they're looking for are abnormalities inside the esophagus.
There we go. So you can see there's a severe narrowing here in her esophagus.
That's really narrow.
Yeah, so we can get through with our little scope, but you can imagine a whole lot of dog food just can't get through there, causing her a lot of distress and making her regurgitate.
And imagine with all that saliva just sitting there, she's probably got constant heartburn. No wonder she doesn't want to be touched. Gypsy has a condition called a persistent right aortic arch. Now, it sounds all fancy, but basically it means that Gypsy's got an extra vessel in her chest near her heart that is constricting her esophagus, her food pipe.
Gypsy now requires urgent surgery to open up her food pipe. Her regurgitation problem has already caused her to be underweight, and there could be far more drastic repercussions.
They could inhale some of that material that comes up. It could cause them to choke in their throat, or worst case scenario, they could cause a terrible infection in their lungs, and then she's dealing with pneumonia as well. So it's something we really have to fix.
Good girl.
Gypsy's going to have surgery. The surgery would be open chest surgery. So that's the part of the esophagus where the narrowing is. So they will have to open up her chest, have a look in there. Then she'll have to stay in hospital for quite a few days after that to recover.
I think it's just that, you know, you get a dog and you know, especially someone like Gypsy, and then you find out she's got something like this. You know, it kind of hurts a bit. I've been emotional. Okay.
The surgery is big and it's risky and it's painful. It's chest surgery, but the benefit that she might go on and be able to eat like a normal dog certainly outweighs all of that.
I need a hug.
You need a hug? You'll be fine. We will look after her, I promise you. It's going to be a long night, but we will, you know, we will give her all the love in the world. They are so nervous. There's some big things ahead, and hopefully we can get her through this.
I'm not going anywhere.
I'm staying here, all right, hon?
Okay.
At Sash, Gypsy is about to have her chest surgery.
Hey, you're a good girl. Yes, you are. You're a good girl. Good girl.
Even though Gypsy's had some sedation, she's still really, really nervous. You can just see the look in this dog's eyes. She's just terrified. So I'm going to stay in the room until she's under anaesthetic, just so that she's got a familiar face.
Specialist surgeon Andrew Marchevsky will attempt to fix the rare condition she has been suffering from since birth.
Gypsy's got persistent right aortic arch, which is a congenital abnormality that basically ends up with a narrowing of her esophagus. And as a result, when they try and swallow food, it just comes straight back up. If she keeps doing that for the rest of her life, eventually she's going to end up with pneumonia. And that can be catastrophic, they can die from that. Bleeding's always a potential problem in the thorax. There's lots of big blood vessels because you're right near the heart. We just got to be really careful. That's the actual band of tissue there that we're going to be cutting out. So we're just going to cut one side like that. And then we'll grab the other side. And now you can see that band is gone. And now as soon as we've cut that, you can just see the esophagus expand.
I promised Hazel and Roy that I would be there every step of the way. How's it going?
Well, I knew you'd be interested.
Yes.
I mean, it's looking as good as we could hope. Well, we'll see how she goes.
All right. It's going to be a long recovery process. Gypsy's had big surgeries.
Doing really well, sweetie. Good sleep.
We're just going to have to wait and see how she goes day by day, one step at a time.
I am going to go and get your mum and dad. What do you think? What do you think about that? You want to see mum and dad? Yes, I do.
It's been 24 hours since Gypsy's chest surgery. Today, her owners Hazel and Roy will find out if the operation has worked.
I was a bit emotional all day. Well, you know, like, pretty apprehensive, wondering how it was going to turn out.
Hello. Good. How are you?
Here's a little baby.
You ready?
Yes.
Come on.
Okay.
Thank you.
I don't want her getting too excited, but I know she will.
Gypsy, hello, darling.
See? Good. Hang on, Gyps, sweetie. I'll open it in one sec. I just don't want her to get too excited because she's had chest surgery. But as soon as she sees them, she's just wanting to jump all over them. We're trying to keep her calm. But the poor little girl is so excited to see Mum and Dad.
Come on, Dad.
Just stand here. Not too much excitement, hon.
Good girl.
It's not dry food just yet. It's a little bit more solid than liquid, so we'll transition her very slowly. But this will be a really good test to see how she goes.
No, wait.
Will Gypsy finally be able to eat a meal without pain?
Good girl.
Okay.
Good girl.
Okay.
Off he goes again.
Really happy for him?
She's your baby, isn't she? Oh, how good's that? She can reach her potential now because I think this was going to only get worse and we could have lost her, and that's unthinkable.
Last time she would have already brought it up by now.
Yeah, oh, absolutely. She would have been in great distress by now anyway.
So how does that make you feel?
Very good.
Yeah.
Excellent. Excellent.
It's exciting.
Yeah, and she's smiling.
Yeah, she
Big
is.
smile on her face. She's just like a different dog. I can't even describe the progress that we've had. This is one of the most exciting things I've seen. I saw how hard it was for this little girl to eat, and now she can eat like a normal dog, and that is just priceless.
G'day.
Come on in.
At Sash, it's been 3 days since Gypsy's risky surgery. Roy and Hazel had almost given up hope of their little girl having a normal life.
What an incredible reunion. Gypsy was jumping all over Hazel and then jumping on Roy and back to Hazel and Roy, and she just didn't know where she wanted to be, but she just knew she feels good and she feels happy and life is great.
You're looking well, aren't you?
Did we come to get you? We were always going to come and get you.
You got your girl back.
We
Huh?
have.
You got her back. And you, miss, do I get a goodbye hug, please? I got such a warm hug from Roy and Hazel, and the first time they ever hugged me was to say, please look after our little girl. We hope she gets through the surgery. And now they've given me a big hug because everything's worked out and they're getting their little girl back home as a normal dog. It's just wonderful.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.